Hello students, welcome to Pathology PYQ series. Infraction and shock are generally asked as a LAQ or not as a SAQ. So you need to prepare both of these topics for 5 marks each. Then only you would be able to write a LAQ. Very important question. Do not leave. It would be slightly longer, so let's rush into it. So what is the introduction? See, infraction and shock are important consequences of hemodynamic disturbances. What is infraction? Infraction is an area of ischemic necrosis caused by obstruction of blood supply to a tissue and organ. Simply means that for any particular organ, there is ischemia. Basically, that region is cut off, there's no blood supply. So, what happens is there is cell death in that particular area. But write the definition shown above technically. What are the causes? There are four most important causes. First is arterial thrombosis, which is the most common. Second may be embolism. Third is venous obstruction. Venous obstruction, simply veins failure, blockage, because vein vessels are thin and they are all under lower pressure, so they give out first. And last is torsion of vessels. Torsion of vessels is nothing but organ rotation on its own axis, twisting the blood vessels that supply it. So when the thing goes 180-degree, all the blood vessels get constricted and the blood supply is affected. It is a surgical emergency. It can be treated. What are the types of infarct? There are only two types of infarct, red and white. White generally happens because uh, where there is infraction of platelet rich and fibrin blood. So which is seen in solid organs such as heart, kidney, spleen. Whereas the red or hemorrhagic infarct is seen in lungs, intestine, organs with dual blood supply. Basically, there are a lot of RBCs, and when there is an infraction, that area becomes bright red. Whereas in the case of white infarct, the area turns pale. Morphology, if you see the morphology, it is usually coagulative necrosis except brain. Okay, wedge-shaped lesions you will find, and hyperemic border around infarct. What is hyperemic border? Hyperemic border is a bright red congested zone marking boundary between damaged and healthy. It is just like a border which shows all the ischemic area and normal area. Complications: healing by fibrosis, organ dysfunction, or rupture, which is myocardial infection. Any of that can happen. Now, second part is shock. See, shock is a state of systemic hypoperfusion resulting in inadequate tissue oxygenation. In infraction, there was reduction in blood supply, and in shock, there is reduction in tissue oxygenation. Oxygen content comes. Hypo, you understand less, so which leads to cellular injury. So, what are the types of shock? Very important, five types of shock: hypovolemic, cardiogenic, septic, anaphylactic, and neurogenic. Hypovolemic simply as the name suggests, hypo means low, volvic means volume. So, due to blood or fluid loss. Second is cardiogenic, due to pump failure, such as MI. Septic shock, due to severe infection and endotoxemia. Basically, the toxin levels increase in the blood to such level that the body goes into shock. Fourth is anaphylactic shock, which is severe allergic reaction. Some people are uh, idiopathic to many other things, so it can be any of that. Fifth is neurogenic shock, which is due to spinal injury or anesthesia. What are the stages of shock? CPI. Always remember the mnemonic. Stages of shock and types of shock you would be asked in your theory exam, and when you will go for your viva, the external examiner would surely ask you this. So, what are the stages of shock? First is compensated stage, in which there is tachycardia and vasoconstriction. Here, the body is trying hard to revive. How it is trying hard? It causing by trying to raise the blood pressure by vasoconstriction. Second is progressive stage. Progressive stage is basically hypoperfusion and lactic acidosis. Because of less oxygen, the condition becomes anaerobic and there is lactate production, which is called lactic acidosis. All this leads to third stage, which is the irreversible stage. If the progressive stage has been continued for a slightly longer period of time, it will cause various organs to stop responding, which we call multi-organ failure. So, what is the pathogenesis? There is reduced cardiac output, which leads to decreased tissue perfusion. Basically, tissue don't have that oxygen which they require, which oxygen enters and covers all the tissues, which leads to hypoxia. Hypoxia leads to anaerobic glycolysis, which forms the lactate, which is called lactic acidosis. This lactic acidosis causes cellular damage and organ failure. So, simple pathogenesis shock, I think everyone should do because it is very, very important. If infraction would not be found or asked of you, even shock can be asked and one or two questions added to make a LAQ. So, don't leave shock anyhow. Complications: acute renal failure, ARDS, acute respiratory distress syndrome, DIC, disseminated intravascular coagulation, which leads to using up all the blood clotting factors due to the consumption of platelets. And lastly, multi-organ failure. So, what are the exam quick points you need to remember? Infraction is ischemic necrosis. White versus red infraction, what are should do. Septic shock is common in ICU settings.